Welcome to this Institution of Mechanical Engineers webinar on the challenges and complexities of manufacturing and distributing COVID-19 vaccines. My name is Dr. Tim Fox, and I'm chair of the IMechE Process Industries Division, and we'll be hosting today's event. This webinar has been organized by our Pharmaceutical Committee, one of the 6 technical advisory committees of the board. And it gives me great pleasure to introduce a superb lineup of really excellent speakers this afternoon. And you can find all their detailed biographies on the web page you access to register for today's event. In terms of the order of proceedings this afternoon, first we'll hear from François Meurice. François is the Vaccines Ambassador, Scientific Affairs and Public Health Director at GlaxoSmithKline. And he'll be talking to us about some of the manufacturing processes and the challenges associated with them. Essentially, how do we make the vaccines and how do we get them into the supply chain? Next, we'll be joined by Professor Toby Peters. Toby's a leading expert and certainly the world's leading thinker on all aspects of sustainable cooling. And he's the professor of cold economy at the Birmingham University. Toby will spend 5 minutes enlightening us on the many complications and considerable challenges in distributing equitably and sustainably COVID-19 vaccines. Toby will then lead a conversation on many of the issues raised in the 2 talks with 3 leading subject matter experts. I'm really pleased today to be joined by Dr. Christopher Green, who's a consultant in infectious diseases and general medicine at the University Hospitals Birmingham NHS Foundation Trust. He's also a senior clinical lecturer in infectious diseases with the Institute of Microbiology and Infection at the University of Birmingham. I'm also joined by Pat Morn. Pat is managing director, group managing director of Zanuti Group, and Zanuti are refrigeration suppliers, part of the Dakin Corporation. We're also joined by Diane Connet, who's an energy specialist with the Southeast Asia Department of the Asian Development Bank, which is a real pleasure to have Diana with us today. So following that conversation, I'll then chair a 15 to 20 minute Q&A session with all the speakers. So please do submit your questions as we go along via the Q&A function that you have available to you. And I'll be fielding some of these questions to our speakers in that Q&A session. The whole event will be recorded and it'll be available after the event on the IMechE webinar hub. So it promises to be a very timely and an extremely interesting and stimulating hour. So let's get on with it and let's get started with François. Over to you, François.
Thank you very much. Thank you for having me here, and good afternoon, everyone. I'm delighted to have the opportunity to present on vaccine manufacturing and supply, and this is going to tackle the challenge that we have today for most vaccines. So it's not specifically within the context of COVID-19. It's really a talk which is usually what are the challenges with vaccine manufacturing and supply. Do you hear me well?
Absolutely fine, François.
Okay, good. So let's move on to the next slide, which is just a disclaimer slide to remind you that I'm a full-time employee of GSK. And the first slide is actually telling us about the differences between vaccines and non-biological drugs. And it's important to keep this in mind as a reminder, because from composition to development or administration, there are many differences. I mean, the first one, when we talk about composition, is certainly that vaccines are complex substances and usually contain various core components, which are active components. While for non-biological drugs, typically they are made of a single active chemical component. Another big difference relies in the size of clinical trials. Vaccines are enrolling healthy subjects, as you know, so we'll need to have large community-based trials to follow the epidemiology of diseases, especially when we're talking about transmissible disease, infectious diseases, will need to have the subjects being naturally infected by those, at least in the phase 3, to prove efficacy of a vaccine. While for non-biological drugs, these are typically smaller clinical trials in patients who have a condition or a disease. Now, from a regulatory approval, this is also a step which is complex, which is time-consuming, which lasts usually about a year to a year and a half, depending on the vaccines to be reviewed before they're authorized for licensure. This is usually a little bit less complex with drugs. In terms of supply, one of the specific features of vaccines is, of course, that cold chain is required, and we'll hear more about that. It's much less common for non-biological drugs. Vaccines have long lead times to market from production to supply, and we'll see that in a few slides in more detail. Finally, for the administration, most vaccines are given by injections, in several injections, sometimes single injections, but when there are more than one injection, there can be extended periods of time between doses, 1 month, 2 months, or even more, or years if it's booster doses. While for drugs, of course, it's regular intervals, often with daily schedules. If we move to the next slide, this is just to remind us that the journey of a vaccine from production to distribution is complex. We've seen in the previous slide that vaccines are complex substances, biological products, usually more than one active component, and there's inherent variability in source materials and biological systems that are used. Now, the manufacturing itself is a process that involves many complicated steps, and it's not unusual for vaccine production that you may have some parts of the manufacturing process which are done on one manufacturing site, other in another, and you have to ship components of vaccines from one site to the other before the final formulation and packaging. The regulatory requirements, as we said, are complex. What's important to realize is that there are hundreds of quality control tests and retesting to ensure vaccine quality, safety, and efficacy. We are not here in front of a chemical compound where you can apply a chemical formula and you have your product. Here, the biological nature of the vaccine makes it very important to test the quality of each step of the process. And those tests are performed not only by the manufacturer, but they're also done by the exporting country or by the importing country. So that's done for every batch of vaccine, which can also explain some of the vulnerability of the supply chain and some of the disruptions that can potentially occur at any stage. And some of those, let's say, disruptions can be due to unexpected changes in the demand, if there are disease outbreaks, if there's migration moves or others, or of course when tests which have been done for quality controls are failing, or if one of the authorities does not reproduce exactly the same result of the test. So all these are reasons to delay along the line the supply. Let's move on to the next slide, which is an animation. So in the first animation, we see that after the R&D process itself, which can last on average about 10 years, but we've seen for some vaccines, like for instance at GSK, the malaria vaccine, which has just been completed, has taken more than 30 years of research and development. So after that step, we have the regulatory approval, and then batches of vaccines need to be regularly manufactured. So if you click on the first animation, you'll see that the first step is the reception of the raw material, which is a short step. But after that, you have the bulk manufacturing and maturation, which can take sometimes about half of the production time. For some products, you need to have this step of maturation to make sure that we have the right quality of the product before going forward. On clicking to the next one, we are the step of coupling, filling, formulation and quality controls, which can last 6 to 10 months. And finally, on the next one, we'll get at the lot release, the packaging, and the shipment step. If you click again, you'll see that all along there is quality control and assurance. And what is important to realize is that this can take about 70% of the production time, this quality testing and release. If you click on the next one, you'll see that all along patient safety and pharmacovigilance continues to be monitored, and potentially any safety information needs to be added into the label. Now, clicking on the few next ones, you'll see that all the quality controls, the testing done by the manufacturer, the testing done by the exporting country, by the importing countries, all that is all along. And you can click until you see the cold chain coming up, which is just to remind people that the maintenance of the cold chain is really essential for preservation of biological products, and this adds extra complexity to the process. So I think I'll end here with that part of that presentation, just reminding everyone how this manufacturing journey can be complex, can last up to 24 months, 36 months for some vaccines. Fortunately, there are ways to make it shorter, and that's what's going to happen here with the COVID vaccines. Thank you very much.
Thank you very much, François. And now we'll hear from Toby Peters for 5 or so minutes. Toby.
Thank you, Tim, and thank you for welcoming me here today. So I just want to give a quick overview of the challenges. We're doing a lot of work on the solutions, but let's look at some of the challenges before then having a discussion with the panelists. So an effective vaccine is seen as the world's best bet for overcoming the pandemic. But let's be clear, achieving herd immunity means delivering this vaccine effectively to potentially 60 or 70% of the population. And so that means maybe 5.5 billion people. If you've got to do 2 doses, we're talking about maybe 11 billion doses to be distributed. Given, as we've heard, the vaccines are temperature sensitive, achieving this successfully will therefore depend on the robustness of cold chains. Given the volume and speed required to get our economies going again, this is probably, in my view, the single biggest logistics challenge we've ever faced. Drill down one step further, it's probably the biggest global refrigeration challenge we've also ever faced. Universal vaccine access is an existing major challenge in low and middle income countries already, due to the lack of fully integrated functioning cold chains. In actual fact, nearly 3 billion people, I think, live in areas that lack temperature-controlled storage to deliver the COVID-19 vaccines. The barriers are obviously insufficient capacity, but also inefficient cooling equipment, inadequate maintenance, lack of access to energy. So big challenges to be resolved. But even in the countries with the robust vaccine programs, there are going to be a lot of challenges in managing this volume of distribution. India, for example, has the world's largest vaccination program. It distributes about 400 million vaccines, immunizing 56 million children and mothers to be each year. India plans to initially immunize maybe 250 million people. So that's going to be 500 million vaccines, ideally in the space of 6 months, not a year. And for herd immunity, India probably requires 800 million people to be vaccinated, maybe 1.6 billion doses. So you can start to see the magnitude of the problem. And at the same time, let's not forget, existing vaccine campaigns must be maintained. UNICEF, WHO currently estimate, I think, that about 80 million children are at risk of missing out on vaccinations due to the pandemic. Another challenge is that a large proportion of populations live in rural, remote areas in developing countries. So a key challenge will be immunization in the outreach and the last mile distribution. This can account for 50% of the population in some markets. And you've got geographical barriers, poor infrastructure, bad road conditions, all making the problem more difficult. There is a piece of good news, of course, is that whilst the ultra-low temperatures of the Pfizer vaccine add a unique set of problems, there are other fridge-stable vaccines, such as with Oxford, coming online soon, we hope, which will better suit wider population coverage. But that doesn't change the need for cold chain and the need to ensure equitable distribution, but it does perhaps make the type of equipment more standard. But there's another dimension which we need to think about. Cold chains are energy intensive and rely on refrigerants, often with high global warming potential. So given most of the technologies deployed today will still be in operation in the next decade, this expansion of cooling equipment from manufacture to outreach cold box must, as far as possible, be based on technologies that are environmentally sustainable and clean. But can we go further? Can novel technologies unlock modal shifts and allow us to think about opportunities in broader temperature requirements? In fact, open the door to deliver a lasting COVID-19 cold chain legacy that is both resilient and sustainable. As one example, drones are already proving their value for rapid delivery of pharmaceutical products. Can we enhance that or use that better? At the same time, we're seeing off-grid and pop-up mobile cold rooms. Could these enable not just simply more cost-efficient campaign approaches for COVID distribution, but potentially be able to be repurposed once the substantial but temporary need for COVID-19 immunization is addressed? So, at the system level, can we also look at how can we have multi-sectoral synergies and how these could be exploited, potentially having integrated services? How do we deliver food, agriculture, as well as health? Because we mustn't forget that currently, probably less than 15% of the cold chain capacity we actually require today, we actually meet. With vaccines requiring temperature control throughout every step of the logistics chain, cooling is a serious issue of equity that underpins equal and fair access to vaccines. And as the governments and NGOs develop their plans, cold chain must both guarantee the health response and draw on the most sustainable solutions to build long-term resilience. These choices and the cost and the environmental impacts will live with all of us for decades to come. And at that point, I'd like to turn to our panelists and ask them some specific questions before opening up to the audience. So, Diana, if I could come to you first. You're working in Southeast Asia. So using that as an example, what do you think are your specific challenges for delivering this speed and volume in Southeast Asia?
Yeah, thanks very much, Toby. You hit on several of the dynamics that we're facing. I'll try to summarize quickly what we're looking at as we design programs and work with developing member countries on loan programs to support their distribution. Even before the pandemic, the World Health Organization estimated that about 50% of vaccines may be wasted globally every year because of temperature control, logistics, and shipment-related issues. That could represent staggering setbacks and wasted investments in response to COVID-19. A 2017 study found that 10% of health facilities in Gavi-supported countries did not have the recommended equipment. We know that cold chain for vaccine is not a new challenge in Southeast Asia, where I work. It more reinforces the global inequalities as well as the domestic inequalities within nations, particularly in urban and rural divides. There have been many outbreaks of vaccine-preventable diseases in recent years where I live. In the Philippines last year, we had outbreaks of measles, diphtheria, and polio. And even before COVID-19, Indonesia, the Philippines, and Vietnam were among the top 10 countries in the world with the most unvaccinated children. There are several reasons for this. First of all is electricity reliability. For example, only 24 and 40% of health centers in Cambodia and Myanmar are connected to grid-based electricity. Where I live, there are still 12 million Filipinos who don't have access to any electricity. And there are many places across the region with intermittent electricity. Maybe they have up to 6 or 8 hours a day or frequent outages. I think most folks on this webinar know that intermittency can damage refrigeration equipment that's not specifically designed for it. Second, health centers are often fragmented and chronically underfunded. Where I live, for example, some are financed by the national government, some by the local government, some by religious organizations, some are private. It makes alignment and training for cooling equipment particularly difficult. And third is procurement. Procurement and operations and maintenance are not always straightforward. Countries have different rules.
Oh. Have we lost you, Diana?
Yeah, it looks like she's disconnected. The internet's gone. Maybe she's had a power outage.
Okay, well, we'll come back to Diana hopefully when she comes in. Chris, whilst we're waiting, can I jump to you? Many countries, they have vaccination programs for millions of children every year. But why is this so different?
Thanks, Toby. So you're right, there is vaccination programs in many countries. Those programs are really childhood immunization programs. And the vaccines that are included in those expanded programs of immunization really reflect the local public health need, and of course the other factors such as access to the vaccines and suitable storage and transportation. One of the critical differences that we can all be very thankful for with COVID is of course that there is not an excess disease burden in children. So the existing vaccine chains supplying the childhood immunization program really land in school children age population. So they could be set up to be delivered at schools or nursery homes or primary care facilities. One thing that's very clear from COVID is that the worst cases of severe disease land largely in the elderly. And so it is, of course, useful to have a cold chain for vaccine supply, but it doesn't actually land in the populations where you may wish to give the vaccine. And of course, that depends from country to country. So somewhere like here, we talk about giving vaccinations to care home residents because that's where our elderly and most vulnerable populations are. And if you look at the other priority targets for vaccination, include those with severe comorbid diseases and immune suppressed adults. And so it obviously has to be developed with what you've got, so to speak, in low to middle income countries, but it has to be adapted in its final mile, if you like, towards people who need vaccination as a priority first. And then secondly, even once we've got through that tranche of people who are at higher risk of developing severe disease, hospitalization and death, the next set of vaccinations will probably be towards working age adults. And so it's a different mission, so to speak, compared to a usual seasonal or childhood immunization program.
Thank you. So, Pat, coming to you as an industry and a manufacturer, we need to manage this cold chain from our airports to every corner of the country. We've heard we've got to land it right in the right community as well. Where do you see some of the big technology challenges?
So thank you, Toby. And as my co-presenters, Diana and Chris, have enunciated, the challenge is huge. Disruptions are to be expected in the cold chain, and resilience of the cold chain is everything, right? The cold chain exists in various forms in various areas in the world. Most of those are not complete, right? So we have to extend the cold chain. There is the challenge of ultra low temperature and low temperature, which can be different from standard vaccine delivery that the industry has been used to. However, right, the world is engaging very, very quickly, right? You will note that I talk about the cold chain, and I don't talk about a common theme that I've heard over the recent months, the pharmaceutical cold chain. We're of the belief that the cold chain has to be integrated. We need to use the already embedded cold chains to deal with a mass event that we are facing today, right? We need to be able to repurpose existing cold chain solutions for all of the varying problems that we will face. We will face, as you say, from airports to islands, from airports to parts and distribution centres that are not connected to the road networks. We will have to use sea, rail, all right, air throughout the cold chain, down to last mile delivery that could be as much as non-motorized transport. So the challenges are great, but we have a cold chain. We have to work on the resilience, and we have to expect, right, that we will have disruptions, and we need to plan, right, that those disruptions are taken into account by that resilience.
Thank you, Pat. And I imagine one of the things which people need to be thinking around, along with equipment, is going to be actually the refrigeration engineers to maintain it. Diana, are you back online? Are you?
I am. Apologies for the connectivity.
Just moving on, and obviously if there's anything to add from your previous thing when you got cut off, please do add. But look, we're hearing we've got a big challenge, and it's not just fridges, it's going to be infrastructure. We need electricity, roads. Blunt question, as the Asian Development Bank, how are we going to pay for it?
Yeah, thank you for that question. The response to the global pandemic is expensive, and this is a time when many countries are suffering the most. Fortunately, COVAX is working to ensure equal access to vaccinations for all countries, but this opportunity caps out at 20% of populations. So while pursuing vaccines through the COVAX facility, many countries are also conducting bilateral negotiations with biopharma manufacturers as well as cold chain equipment suppliers directly. UNICEF, World Health Organization, Gavi, and other development partners are supporting developing countries through technical assistance to assess and plan vaccine distribution. International development financiers like the ADB, like the World Bank, and others are helping to fund these plans that are laid out by the countries themselves. In many countries, UNICEF is conducting the cold chain assessments. The World Food Program is supporting primarily with the private sector agricultural providers who could be able to pivot to support vaccine distribution. There are lots of tools that have been set up to help countries plan and respond. Many countries have by now developed vaccine distribution roadmaps, and these roadmaps are a critical planning step. For international financiers like ourselves, this is a prerequisite in order to access our accelerated vaccine finance facilities. In my region, the awareness of cold chain criticality has increased dramatically, but we are far from connecting a comprehensive system. In fact, in negotiations, many countries are prioritizing the Sinovac and the Sputnik V vaccines for many reasons, including their more accessible temperature requirements. As my colleagues noted, vaccines need to be connected by cold chain at every single step. And in the region, many health facilities aren't able to provide assurance of this. So right now, some of the more creative countries are working with their private sector agricultural cold chains, food, fisheries, and agricultural value chains that could be able to support this response. And we hope that we can build a base of knowledge to allow for flexible multi-sectoral cooling services in the future coming out of the COVID-19 vaccine. Investment in new business models is important. It can help, but it will not guarantee access to every person in every country. That's the responsibility of governments. So we're working with them to make sure that they're meeting their own goals.
Thank you, Diana. And I'm really pleased to hear that this idea of we're hearing again and again the sort of cross-sectoral opportunity. Chris, coming back to you, this issue of equity. I think it's said that if we have equitable distribution, it will prevent 61% of subsequent deaths. But were the vaccine distributed to high-income countries first, we're only going to avoid about 33% of those deaths. So equitable distribution for you, I think, is a really key issue. and for me as well, when do you think we're going to see mass rollout of vaccines in low and middle income countries? I think you're on mute.
Thank you for that as well. But I do feel very strongly about this because vaccines do not save lives. Vaccinations save lives. So you have to be able to give these vaccines ideally on a 2-dose schedule if you want to afford best protection for individuals. One of the reasons, as I should point out that I'm a principal investigator for a lot of the vaccine trials that are underway here, and my PhD and background is in vaccine development. And one of the reasons I work so closely with the team in Oxford, having trained there in developing this technology for other respiratory viruses, is that the manufacturing ability to do this at scale is quite favourable, especially also the fridge temperature conditions that are needed for it as well. And that's not a criticism of the mRNA approach, which is totally new and very exciting, but the fact that it has to be stored in freezing conditions is very difficult for distribution. And so the question about when we see a mass rollout of vaccines, first of all, we need to have the safety and efficacy data. As many of you know, we do have phase 3 trial data now for the AstraZeneca Oxford product, which means that provided other countries and their competent authorities, so that's places like EMA or FDA in Europe and the States respectively, but certainly when it comes to low to middle income countries, they'll be looking much more towards WHO and Gavi and other institutions like that, means that we will hopefully have the approval to start rolling out these vaccines in low to middle income countries probably in the summer of 2021, I would imagine, is my best guess. But of course, the scale is absolutely enormous. So the means of distributing a vaccine in somewhere like the UK or the US, of course, means that we can get favourable coverage very quickly. And so just having vaccines available in low to middle income countries doesn't mean that we'll be able to vaccinate a large part of the population very quickly, especially when we think about the challenges of a 2-dose schedule. Even if it has to be required to store at fridge instead of freezer, a 2-dose schedule is still quite difficult.
Thank you, Chris. Pat, can I come back to you? I want to drill right down to this developing world challenge, the last mile. So this is where a lot of the vaccines are lost. It's where the challenge is, and as we just heard, we've got to do it twice in the space of a month with many of these vaccines. So what can we do here to make calling for outreach more resilient?
So the challenge is, Toby, that the systems, solutions and the equipment should be simple, robust, universal, right, and well understood by the operating cold chain within the area. We have seen in the last decade the rollout of through post-harvest food loss. We have seen the spread of basic cold chains, and as Chris has alluded to, certain of the candidate vaccines are more tolerant of these less developed cold chains, with the ability to deal with what is commonly used in food and agriculture. The challenges of then maintaining the cold chain are much more difficult in areas of the world where the cold chain is doesn't have the resilience of a well-trained technical infrastructure behind it. However, right, there are products and services available. There is resilience in the cold chain. We move food from one continent to another. We see the real challenge, as you alluded to in your question, in the last mile. And in the last mile, we also see non-regenerative solutions with cold material. We look at cold storage, right, cold batteries as new potential. And this pandemic is accelerating the requirements for such solutions. But I am sure, and we see, that some of the advanced eutectics that were developed in Birmingham are ideal candidates to extend the cold chain through that last mile.
Thank you. And if I may, we'll go audience questions shortly, but I'd just like one quick fire last round to look to the future. So Diana, we hear this phrase, build back better. Do you see that we can use this massive spend you're looking at to become a real investment in building new cold chain for lasting legacy?
Yeah, that's certainly the plan. I think that the COVID vaccine planning process will have the greatest impact simply in the attention that it brings to vaccine access, electricity reliability, and cold chain connectivity. So some of the best opportunities in the near term to make lasting impacts for vaccine cold chains will be in the improved last mile distribution equipment, which might forego local, potentially unreliable refrigerators in favor of cold boxes and carrying boxes with vaccine monitoring. Also in procurement of solar drive refrigeration and other equipment that's robust to intermittency of electricity, and also equipment demonstrating the benefits of improved energy efficiency and green refrigerants. In the longer term, I hope that some of the new business models, especially around multi-sectoral cooling services, can take hold, and the COVID-19 vaccine is a great opportunity to start to plant those seeds of new business models.
Thank you, Diana. Chris, coming to you. I want to ask a sort of, I think it's a pretty big question, but looking to the future, do we think that mass immunization could become a new norm we need to prepare for, be it annual COVID-19 vaccinations or flu vaccinations, or indeed preparing for further pandemics?
So I think that we don't know enough data about the duration of immunity to these vaccines and whether they still confer protection from several years or just 1 year, and the frequency of revaccinating. So that will come out in time. One thing I would say is that there is a reason why the viral vectored vaccine technology from AstraZeneca and Oxford and Janssen and others, and the mRNA constructs such as the Moderna product and Pfizer product are already at the stage of being able to demonstrate efficacy within 1 year. And that is that manufacturing mRNA vaccines is actually relatively easy, although storing them and distributing them is quite hard. So the mRNA vaccine was designed within days of the sequence of the virus coming out. And the viral vectored vaccine approach is quite favorable for new disease outbreaks because you can essentially have these vectors prepared and primed, just again waiting for the new DNA instruction as to what protein to make. And that's why you see this technology being used with Ebola and Zika and others as well. So it's only a question of time, sadly, before there are future outbreaks and potentially pandemics, maybe every 10 to 15 years or so. And so the ability to use this vaccine technology quickly, as we would do if we had to do this again for another viral outbreak or something similar, would again rely on a pre-prepared distribution model for getting these vaccines to the populations that need them very quickly. So I think this is, the COVID is the great accelerator, as all times of crisis are, but I think the future is that we will be able to develop vaccines very quickly. But again, vaccines don't save lives, it's vaccinations that do, and that needs to have a matched distribution system.
Thank you, Chris. Pat, coming to you, I mean, we can't see equipment just sort of used for a year or 2 years, then sitting dormant at this volume for waiting for the next 10 years or 15 opportunity. So do you think we can repurpose and redesign cold chains so that they're ready as in a more sort of a holistic approach to meet needs across food, agriculture, and vaccines?
So indeed I do. I think we can see today that the cold chain is vital. It's a great democratizer for the world, right? But it needs to be embedded, and it needs to be used on a daily basis, and it needs to be ready to offer a resilience for such global pandemics that we see today, and we may well see in the future. However, right, we have to recognize that the cold chain is vital, but it needs to be more sustainable, right? So we have to work on the both the resilience and the sustainability, and the reach of the cold chain. And then when it is embedded as a true societal engager for human health, food distribution, and well-being, then we will be somewhere close to being able to use it, right, for day-to-day activities, and then when a pandemic requires a response, to be there, available for the response.
Thank you, Pat. And I think as we're at the IMechE, I'd just like to reiterate that for me, resilience is also about having the engineers and the technicians there to maintain the equipment. So thank you very much. I would just like to use this one opportunity to say that one final point. If designing the vaccine is the first pillar of this challenge, making it and manufacturing volume the second, and the third pillar is this distribution, let's not forget that alongside the vaccine, we're going to have all the syringes, the PPE, and all the other supplies being shipped out right to these remote communities. So as we plan this capacity to move everything out, we must also ensure that we're ready to deliver the sustainable and safe waste management and recycling as the fourth pillar of COVID-19 immunization. And on that point, Tim, back to you.
Thanks very much, Toby. Thank you for leading a really fascinating discussion. I think you covered so many of the vital points there, really all-encompassing. We've had questions coming in along the way, and I'm just going to facilitate a Q&A session now that will involve all the speakers we've heard from so far in the hour. I'm going to circle back initially to the manufacturing part of the supply chain. And ask François a couple of questions to kick things off. So François, there's a question around vaccine manufacturing and production. Are they made in dedicated facilities or are they shared facilities? And if we have to create new facilities for manufacturing, how long do they take to design, construct, and commission? And whereabouts in the world are they likely to be put down? Are these all going to be in developed economies and require the shipping of vaccines from those hubs, or are there actually going to be facilities in country?
Well, thank you for the question, Tim. I think that's a great question. It is true indeed that vaccines are made in dedicated facilities. So usually a specific building will be a plant will be dedicated to a specific vaccine manufacturing. Although, as I mentioned before, you can have some steps of the manufacturing which are in one building, other steps in another building, which may be in another site, even in another country. So just to continue to your next question about where are those facilities, for GSK, I think we have 14 different manufacturing sites in the world. So we have sites in Asia, in Europe, in Americas. Of course, you need to have sufficient standards for the production, the manpower which is educated to work in it, but it's theoretically possible to have those manufacturing facilities anywhere. I think there was a question also about bioterrorism and the potential threat to those facilities. So having, a multiplicity of manufacturing sites where you can have the vaccine manufactured and produced is one of the potential responses to that. Now, to address the question of how long it takes, this is usually something between 5 to 10 years. So it's not that building the facility takes really 5 to 10 years, but of course you first need to get the investment, to get the plans, to get the building up and running, but then you need to have it validated. And that step is quite a long step because, as you've seen, the time it can take for certainly traditional vaccines to manufacture lots, it's going to be up to 2 years. So you first need to run and validate the manufacturing and the production of a few first lots, and that needs to be validated by various regulatory agencies. So all that step of building new facilities is at least 5 years and maybe up to 10 years, depending on the conditions and difficulties.
Okay, thank you, Francois. That's really interesting, and it brings us into another question around the cold chain and distribution. So, obviously, we've got two elements to the characteristics of these potential vaccines. One that involves a vaccine that's going to have to be shipped at very low temperatures. Some are calling those ultra low temperatures, and then other vaccines that will fit into a more traditional characteristic of vaccine and food distribution chains. So just focusing in for 1 second on the technical detail, given that this is an IMechE webinar, of the refrigeration plant used for the ultra low vaccines. Pat, what sort of equipment are we talking about for those vaccines, the ultra low temperature vaccines?
So the available equipment and systems break down into two areas. There is the traditional cryogenic solutions that are available, which can be regenerative or single shot systems using ultra low temperature donor fluids, such as a nitrogen base. And then we have direct expansion technology that can bring us to these ultra low temperatures of -70, -90. These generally rely on cascade systems. They have challenges at the moment in that the working fluid is not particularly sustainable, but there are a lot of new candidate fluids that are in trial at the moment, where the global warming potential of the fluid is very much lower than existing fluids today. So in terms of technology, it is very much not one size fits all, but what a particular chain solution requires. And there are technologies available, and there are new technologies coming. Right.
Okay, that's really helpful. Thank you, Pat. I think there's a great deal of a lack of knowledge around within the global engineering community about what type of solutions are involved in these ultra low scenarios. So just thinking a little bit more about some of the issues associated with a fair and equitable distribution, I'd like to just bring in Toby and Diana and talk a little bit about opportunities for the sharing of infrastructure across sectors in developing economies, and how much of a role there is there for a significant improvement in the way that we manage the logistics of these two, what have been up until now, relatively separate supply chains. And what work is actually going on today around the world to look at optimizing the opportunity to share that capacity. Diane, would you like to say a few words on that first, from your position in the Asian Development Bank?
Sure. I think the opportunities around multi-sectoral cooling, so bringing in fisheries and agricultural cold chains, it's important for cold chain integrity, but it doesn't necessarily improve equality issues. Just as there is inequality in the global distribution of cold chain and vaccines, there's a great deal of inequality domestically within countries. There are enormous resource divides between urban and rural places. And food cold chains are relatively new. So they're expanding dramatically every year, but we still see them mostly in major metropolitan hubs. So it's an important opportunity, but it's not going to solve equality issues.
Yeah. Thank you for that. Yeah, and I think that's a very good point, that we, within that equitable distribution thinking, we have to consider the local injustices as well as the global injustices within the system. Toby, would you like to add to that, and bring in maybe some aspects of how we encourage the use of sustainable approaches and technologies within the developing economies of the world as a part of this response?
So I think, as you know, Tim, I mean, I started looking at community cooling hubs and community cooling a number of years ago, and I'm very pleased to see that this idea of integration is coming much now to the fore. I think the challenge is that it's picking up on what Dan said. It's not just about the access to technology, it's about the ability to finance it or pay for it. So what we're looking at is how do you bring the technology and the servitization, cooling as a service? Because if you go to, say, many parts of Africa, 60–70% of the farmers simply cannot afford the cooling services. So it's about the business model, and it's about the technology, and it's also about the training and the support around that. So one of the things we're doing is we're just setting up the Africa Centre of Excellence in Rwanda for sustainable cooling and cold chain, which is looking exactly at this issue of integration of cooling as a communitarian approach, technology, but then bring together the business model, the training to make the changes necessary to deliver this core thing of access to cooling for all who need it. Because let's just remember, as at today, 1.1 billion people in the world don't have access to cooling and suffer the consequences from lack of vaccines, food loss, nutrition, and also safe and environments in which to work and live. I mean, in a warming world, we need more cooling. We need to make it accessible, and we need to make it sustainable.
Thank you, Toby. And one of the things you mentioned, Toby, was that there's a huge amount of data handling, data management associated with operating and running a seamless cold chain. And of course, with the COVID-19 vaccine, there's a lot of data associated with the development and manufacturing of those vaccines, and indeed keeping records of all those that have been immunized. Christopher, I'd like to bring you in here to talk a little bit about the implications maybe for cybersecurity within the system from your perspective.
Yeah, it's been an interesting set of trials to run from a cybersecurity point of view. That's not going to be the way things are normally done in the future. But it's one thing I would point out is that the mission here is to immunize people against severe disease, whereas the trial data that we report is how do we get a vaccine to do all of that for you. But in the real world, a lot of people will have some natural immunity because they've been exposed before. And so a single dose of vaccine will still be effective in some people who have never seen the virus before, and it will be much more effective in those who have seen the virus before, at least once, so to speak. So we've got good reason to be optimistic. It doesn't take away the challenges of having a cold chain and the infrastructure to deliver these vaccines. But it's certainly an achievable goal. If we can do it in the developed countries, we can definitely do it in the developing countries, and it's up to us to try and make that as equitable as possible. And does that answer your question sufficiently, or I'm happy to answer it a different way?
Yeah, and I think I'd like to explore a little bit more with you what the security implications are at the sort of the end use point, and sort of managing the immunization program itself. Given the scale of this immunization program, are there any particular threats there?
The thing about this vaccine in particular, but all vaccines, is it is a powerful social influencer, and so with it there becomes a risk of it being used for political gain, for personal favor, for monetary gain, all of these things. And it's one thing I feel very strongly about is that it needs to go to those who need to be vaccinated first. So that doesn't matter if we're talking about developing countries or low to middle income countries. We've had all sorts of security issues. If you think about the fact that every country's GDP has plummeted to a greater or lesser extent due to COVID, is obviously the quickest way to recover that economic loss is to develop a vaccine, so because your workforce can confidently return to productivity. So there's been all sorts of cyber security issues, probably related to the fact that it has such a powerful effect in the developed countries. And that ranges from trying to steal technology or steal data, but also there has been recent reports of cybersecurity trying to interrupt the cold chain storage of vaccines, or at least test to see how secure those systems are. So we have all sorts of security issues right from its inception, how we make these vaccines, to how we test these vaccines, how we distribute these vaccines, and who actually decides in the last mile, or maybe the last 10 yards, of who gets a vaccine. And one of the things which is, I think, the best way to combat that is to try and show that we are trying to be open and transparent, but equitable to everybody. And these security issues, it's always like a continuous arms race, really. So we develop a new vaccine, and people want to quickly figure out how we did it. We develop a new supply chain, people want to quickly figure out how we've done that. And so you end up in this sort of funny arms race where people who want to, for whatever reason, interrupt that process, or copy that process, or anything else, are continually trying to figure out, but don't want to be more than 2 steps behind, as it were. They always only want to be at least 1 step, or even better, 1 step ahead. But it's not a competition that which we've encouraged.
Well, look, that's been fascinating, and I'm really sorry to say that we're more or less out of time now, because I feel I could continue asking questions on behalf of the audience all afternoon. But unfortunately, we only have an hour, and we've reached the end of that hour. I think there are a myriad of potential webinars and thought leadership discussions to come out of this, and of course a lot of practical action needed on the ground. So I'd like to close by thanking all of our speakers. It's been an excellent hour, and thank you all for your stimulating and thought-provoking contributions. I'd also like to thank Claire Edwards, the chair of the IMechE Pharmaceutical Committee, for organising and making this a superb event happen today. As I said earlier, it will be available on the IMechE webinar hub within the next few days for people to circle back to and review any parts that they haven't quite understood. I hope you as an audience have found the hour informative and thought-provoking, and I want to thank you very much for joining us this afternoon. Have a good afternoon, and have a great weekend. Thank you very much.
Thank you, Tim.
Thank you.